Hi, my name is Stephanie Cacopardo, and today's lecture is about suicide in adolescents and teens and intervention strategies to tackle this important public health matter. Our objectives are teen suicide and its effects. We will discuss the problem statement as well as some statistics. The health educator role, which will be mine, my mission, goals, and vision. The social ecological model, proposed interventions, which will include evidence-based practices, proposed evaluation, potential challenges and barriers, intervention strategy that will include the school-based program that I have come up with, and at the end we will have the logic model that kind of wraps up everything that we have discussed in this lecture, and we'll end with the conclusion. Teen suicide and its effects. Our problem statement is teen suicide is a tragedy amongst everyone, but we can solve this by raising awareness, setting up intervention programs, and educating communities. Most recent research from the CDC found that teen suicide is the third leading cause of death for young people age 15 to 24. Teen suicide is more prevalent in adolescent girls, but specific risk factors are not that easy to find. Teens with mental conditions are also at risk for suicide, as well as the LGBT youth is another population that receives discrimination, which has led to suicide. It is also important to identify demographics and socioeconomic backgrounds in order to further understand teen suicide. Teens living in poverty are also affected by teen suicide. They have higher chances of stress. They may be exposed to drugs as well as home violence. And the population mostly impacted are teens suffering from mental illnesses, those being bullied at school, or victims of cyberbullying as well. The increase in mental disorders has directly affected teen suicide rates. One study found that many mental disorder medications are meant for people older than 26 years old, and that younger age groups taking certain medications may increase suicidal thoughts. Social media may also attribute to teen suicide. Cyberbullying has increased in the last few years with the increase in social media accounts. And this poses difficulty in stopping someone behind a computer screen. What do we know about the issues causing negative impacts? Mental illness is the leading risk factor for teen suicide. Since 1999, suicide rates in teens have increased, especially in adolescent girls. Bullying and cyberbullying can lead to mental health issues, which has led some to suicide. The lack of screening programs in critical areas such as schools may lead to not understanding how to identify someone who is battling mental illness, and understanding the different risk factors and how to identify them is also very important. My role in this case study is the health educator. As the health educator, I am trained in theories and research to promote health education behavior change in individuals and populations. As the health educator, I will review any health training needs, plan health education programs, publish health education materials, information papers, and grant proposals. And my goal is to go to public and private schools to educate students, staff, families, and the community. I believe that targeting schools is a very effective method. If parents and the school system had the resources to better recognize the signs of possible suicide in adolescents and teens, this could prevent many deaths. Here we have a social ecological model, which is a theory-based framework for understanding the multifaceted and interactive effects of personal and environmental factors that determine behaviors, and it also helps for identifying behavioral and organizational leverage points and intermediaries for health promotion within organizations. In other words, it is a framework used for prevention strategies. The key in helping teen suicide is understanding the factors that influence suicidal thoughts. And as we see here, we see the different levels, and each level influences the next level. Looking at the individual level, if teens do not know how to cope with emotions or know their options for help in dealing with depression, anxiety, suicidal feelings, or other mental illnesses, then it will hinder them and lead them to suicidal thoughts. A way to help this age group is educating teens on how to recognize signs, triggers, and symptoms, and this will help them knowing how to deal with mental issues. And it may also help other teens to recognize a classmate or a friend who may be struggling as well. At the interpersonal level, my role as a health educator would be to help families as well as school staff to be supportive, because this may hinder or help depending that type of relationship the teen has with their family. One hinder at the organizational level is that insurance companies may not cover enough for mental health costs. Under the Affordable Care Act, mental illness coverage was one of the largest expansions, but other private insurance companies do not have good coverage for these type of services. One of my goals that would help at the organizational level would be to have a program in schools that had qualified counselors to provide mental health services for students who could not receive it affordably with their insurance. At the community level, churches or cultural barriers that are not supportive of expressing feelings may hinder teens that are battling with mental conditions. And a way to help this is to have schools provide easy access to mental health care referrals for teens who are at risk for suicide. The last level of the social ecological model is the policy level, and in my opinion, is one of the most important ones. Cyberbullying has been on the rise and has been the cause of many suicides in both teens and children. Schools must discipline students who are bullying other students and also report it to the police. One effective strategy that will be implemented in schools will be to have an anonymous box where students may report if they see any type of bullying, and then the appropriate actions must be taken. If these strategies are effective in schools within a community, then it will present successful and lead to funding from the government. Funding is very important for school-based suicide and screening programs in order to help reduce teen suicide rates. The lack of proper funding will pose difficulty in addressing this matter, and it is critical in order to see improvements. Here I have listed 4 evidence-based practices and interventions. By assessing where teen suicide is more prevalent and determining which demographics such as age and gender are at higher risk, it will be easier to then focus on the correct area. Suicide is the second leading cause of death for adolescents between the ages of 15 to 19 years old. Certain cities may be at higher risk for suicide, and this first intervention listed here will also help identify what school districts need the most attention. And in order to assess the factors effectively, the collaboration between me, the health educator, researchers, and epidemiologists will be imperative. In the second intervention, it is important that there is collaboration between child and adolescent healthcare professionals in order to identify and manage adolescents who are at risk for suicide. With the help of clinical expertise, identifying the risk factors for teen suicide will be more reliable. Having professionals involved will help determine what programs will be successful. Also, their expertise will be critical when creating teen suicide screenings and school-based suicide prevention programs. Clinical experts will also be able to educate me, the health educator, school counselors, and the school staff on how to properly care for a student who is dealing with suicidal thoughts, and by providing referrals to quality care centers. The third evidence-based practice is activities that promote families and students to talk about mental health issues. By spreading awareness of teen suicide and understanding the issue will help remove the stigma, as well as increase community awareness. Having these three practices established will help in creating a school-based suicide program for prevention efforts. My goal is to have a school-based suicide program be part of the curriculum in middle and high schools. Part of the framework, and for me the most critical aspect of this program, is having this screening portion. Every student enrolled in middle and high school must be screened every 3 months during the school year. The screening portion is basically a questionnaire that will help me, the health educator, the counselors, and the school staff identify those who are at higher risk for suicide, and also for those who are battling with some sort of mental illness disorder. Going further on how we're going to collect baseline data on the school-based suicide program, we will look at incidence rates around the nation in order to determine which schools we will trial this program at. Once we have established what schools will be participating in this program, we will train their counselors to collect baseline data, as well as have teachers be involved in identifying students at risk for suicide. As mentioned, mental health illness screeners will be conducted every 3 months to collect our data. The positive screeners will then be assessed by the school counselors for appropriate treatment. And those that need further treatment will be referred to a higher level of care. Another essential part of this program will be to hold 2 educational, informative classes during the school year to benefit the parents and to explain to them the importance of preventing bullying and identifying signs of those who are at risk for suicide. These meetings will also explain to the parents the objectives of the program, and we will also explain to them the consequences of students who are found to be bullying other students, and also their support will be greatly valuable. In order to evaluate if our interventions were successful, we will look at our outcomes. We should see an increased community awareness of teen suicide, improved focus on the geographic area most at risk, increased teen and families' access to local services, normalizing mental health disease and opening up to it, which is removing basically the stigma of mental illness, and an increased number of students seeking support through school counseling services, which is a very measurable outcome. And in order to measure our success, we will see 100% compliance of the mental illness screening portion of the program. This will give us 100% compliance from the schools participating. And this should, in return, reduce incidence rates in teen suicide. Some challenges and barriers that we may experience while trying to implement these interventions are a lack of compliance from school staff, poor training in schools. If we fail to properly educate our school counselors as well as our teachers, then we will fail. The lack of funding will also lead to not enough resources. Lack of support from families, because their support is still needed even when the student is at home. And lastly, if the school does not follow through with discipline measures for those who are found to be bullying other students. Here I have created a logic model that will help summarize everything that we have discussed. The Pell Institute and Pathways to College Network defines a logic model as a systematic and visual way to present and share your understanding of the relationships among the resources you have to operate your program, the activities you plan, and the changes or results you hope to achieve. And this is helpful in organizing and explaining my program evaluation, as well as reflecting and analyzing it. And here I have my logic model to reduce incidents of teen suicide. As you can see, under inputs, I have what we are investing. Under activities, I have listed my 4 interventions. Under outputs, it's what we're going to do and who we are reaching. And under outcomes, I have short, medium, and long-term goals. All of this leads to our impact, which is our ultimate goal, and that is to reduce incidents of teen suicide. I hope this lecture was interesting and that it furthered your knowledge in teen suicide. Please share this video to promote awareness and to reduce the stigma of teen suicide. This is a very important matter, and I hope that you have found that there are strategies to help teens who are battling with suicide. Thank you.